Now, have you heard of polycystic ovary or polycystic ovarian syndrome? It's actually a really common condition and it affects between 8 and 13% of women and girls. Diagnosis is often really delayed and it needs often multiple consultations. And now we base it on what we call a clinical picture. So a story of irregular periods. Often we have signs that the girl or the woman has more male type hormones coursing through her body. So that might lead to things like increasing hair in areas that girls don't generally want it. They might get severe acne, a lot of sweating in the armpits. And actually, polycystic ovaries is one of the main causes of infertility in women, but it has lots of other consequences for women and girls with the condition. And when I wrote my book, The New Teen Age, How to Raise Happy, Healthy Tweens and Teens in 2020, our next guest was actually the very first person I reached out to interview, and that's because she is pretty much the guru of the world when it comes to PCOS. Professor Helena Teede from Monash University has once again led a team of researchers to come up with the ultimate guidelines for doctors like me to help us diagnose and manage the condition, and I am thrilled to have her on the line from Melbourne now. Helena, welcome to listen to me, I've got another podcast that is Drive Time, and I'm used to saying welcome to Drive Time. Welcome to Healthy Living. How are you going?
Great. Thank you very much for the opportunity.
No, thank you. It's such an important condition. And look, it's not just a condition that affects women during childbirthing years. I mean, it's really a lifelong condition. But tell us about the symptoms, because a lot of doctors, as well as people themselves who are affected by it, we miss it.
Yeah, look, I think it's because it's quite complex and the features are quite broad, and we do miss it. I think that one of the things that really set me on this journey in terms of working with women very closely for nearly 2 decades now and listening to their challenges and doing the research and getting the guidelines out there and the messages to improve care is because they are pretty frustrated and pretty underserved. And the reason is it's complex. So you described the key features, including irregular cycles, that the egg doesn't necessarily ovulate every month. Women have challenges with fertility, but they also have psychological features. And have much higher prevalence of anxiety and depression, and many of them, especially when they're not diagnosed, get quite frustrated by knowing something's wrong but not knowing what it is and not knowing how to treat it. And the other side of it is that there are metabolic features, such as higher levels of insulin, which don't work so well in the body, much higher risk of type 2 diabetes at a much earlier age, and women with this condition are more likely or at higher risk of putting on weight, and that weight then causes the condition to be more severe. So they get caught in a significant spiral without support and without knowing why it's happening. So it's really important we do them justice, make the diagnosis where it's there, and then help and support them to prevent those complications.
It's such a great point. I know that you've just done another review that has been published and well done. I think you've led pretty much every review that I've read in terms of guidelines. But you have also created that Ask PCOS app and that you've developed at Monash University. It sounds amazing. Can you tell us about it?
Yeah, look, thanks for the opportunity to talk about it. So women get frustrated because often they see different people. They may see a dietitian, they might see a dermatologist for their skin, but they usually see their GPs. Sometimes they see fertility specialists, sometimes they see hormone specialists. But often they will just manage one small part of what is a complex condition for women. And so they really what we need to do with this condition, which is lifelong, we actually find features of this in childhood much more clearly manifest in adolescence and puberty, but they do go lifelong, as you mentioned. And so really it's the woman who needs to live with and take carriage of this condition, and the health professionals who need to feed in and support her to do that. So the app was a way of listening to women, finding out how they wanted their information, providing evidence-based, free information with no commercial impetus. It does not sell you anything. It does not tell you anything except what's evidence-based, including evidence about women's experience with the condition. So the app is now used in 156 countries by well over 20,000 women on a regular basis. It allows you to check the diagnosis. It allows you to track your symptoms. It allows you to record things that you can then report back and forth to your different health professionals. And it answers most of your questions because it was based on the top 93 questions women with PCOS have, and all the answers are in there. And then it allows you to drop down a menu of specific questions. So it might explain to you what male hormones are, as you mentioned earlier. But then the question that will drop down is, so what are my male hormone levels and what does that mean for me? So it gives you most of the information you need, but allows you to do that personal interaction with your healthcare provider.
Which is just so helpful given that it doesn't always go that well. I did want to ask you, I have noticed amongst my patients that there seems to be a bit of a crossover between polycystic ovarian syndrome and pelvic pain that often subsequently gets diagnosed as endometriosis. Do they go together, those conditions?
Look, there's not a lot of evidence they do, but if you think about the fact that both of them affect around 15% of women, and women with polycystic ovarian syndrome are more likely to seek care, it may just be that we're actually getting the diagnosis more likely in women who have this condition, because we know endometriosis is also really neglected in terms of diagnosis. It's often actually harder to diagnose than PCOS. But there's not an evidence that there's an increased prevalence. They're both just very common.
Interesting. Now, I know there's also an event coming up on September the 20th. I was hoping you'd talk about that as well.
Yeah, so we're not going to tell women about their condition. All of that information co-designed with women and written in simple language is all available on the app. We're going to be there to answer questions and answers. So basically we've got a team of experts and including experts in lived experience of women who have PCOS, and we'll be there online for a couple of hours to answer questions. And we ask people to send them in, but we also will do them live. And that's part of PCOS Awareness Month. We'll note that there's many famous monuments that have actually been lit up in the colour teal, which is a popular colour in Australia at the moment for many reasons, but actually is also the colour of PCOS and the support group. So it was World PCOS Day just recently, and it's PCOS month. So over that month there's a number of events, and this one is just about answering the questions that women have.
Well, for everybody who's listening, if you or someone you know could possibly be affected by PCOS, you are not going to have access to an expert like Professor Teede, and also there's some other experts on there as well like this. So jump on the 20th of September. It's www.askpcos.org. Helena Teede, thanks so much for joining us on Healthy Living.
Thanks for the opportunity. Good evening.